Lithogenesis, or the formation of kidney stones, is a complex process that occurs when specific conditions lead to urinary supersaturation with crystallizable substances. Several factors contribute to this supersaturation. The increased urinary concentration of crystallizable substances can be secondary to reduced diuresis. When urine output is decreased, urinary supersaturation of crystallizable substances is favored, increasing the risk of stone formation. This reduction can be due to insufficient hydration, which is one of the main risk factors for kidney stones, excessive sweating due to hot climates or intense physical activity leading to fluid loss. Secondly, this supersaturation can be linked to excessive excretion of crystallizable substances in the urine caused by dietary excess or high intake of certain substances, which can increase their urinary concentration. For example, excess dairy products, vitamin D, or other calcium sources can lead to calcium stone formation. A diet rich in meat can increase uric acid levels in the urine and underlying conditions. Certain diseases can cause overproduction of crystallizable substances. Hyperparathyroidism, malignancies, or prolonged immobilization can cause excessive calcium production. Diseases such as gout or chemotherapy treatments can lead to uric acid accumulation. The excessive renal excretion also plays a role. Some individuals excrete high levels of certain substances, promoting stone formation. Idiopathic hypercalciuria, or excessive calcium excretion without an apparent cause, is a major risk factor for calcium stones. Uric acid excretors. People who excrete excessive uric acid via the kidneys may be at risk for uric acid stones. Okay, the second mechanism that leads to this stones formation after urinary supersaturation is a decreased in crystallization inhibitors. Normal urine contains substances that inhibit mineral salt crystallization and therefore prevent stone formation. A reduction of these inhibitors contributes to a lithogenesis. The main crystallization inhibitors are citrate, which plays a key role in preventing calcium crystal formation in urine, magnesium, which helps inhibit calcium phosphate crystal formation, pyrophosphates, also involved in preventing salt crystallization, and mucopolys acarides. These substances additionally inhibit crystallization. In addition to the previously mentioned factors, other conditions can promote the formation of kidney stones, like the stagnation of urine, which can favor stone formation due to crystal accumulation in the bladder or urinary tract. This may be caused by conditions such as hydronephrosis or benign prostatic hyperplasia, which obstruct urine flow. Urinary tract infections, particularly those caused by urease-producing bacteria, can lead to stone formation. Urinary pH plays a crucial role in salt crystallization. And finally, the presence of foreign bodies, such as JJ stents, which are urinary catheters, or surgical sutures, can promote stone formation.